In this episode of the Nurse Practitioner Podcast, Dr. Efrat LaMandre discusses providing healthcare to the LGBTQ community. Dr. E is a medical entrepreneur who owns EG Healthcare, a medical practice delivering comprehensive pediatric, adult, and geriatric care to a 20,000-strong patient community. The practice is lauded for its dedication to fostering an inclusive and safe space for the LGBTQ+ community. Pioneering in health management, Dr. E has developed the new method, a functional medicine approach that empowers patients to take charge of their health, reduce reliance on medications, and improve overall well-being. Dr. E's entrepreneurial spirit has also led to the founding of Hawk Scribes, a medical scribe company aimed at enhancing patient-provider interactions. Her latest venture, EG Prep, supports newly graduated nurse practitioners in honing their clinical skills. Alongside her practice, Dr. E is a dynamic public speaker and consultant for nurse practitioners embarking on private practice. In her prominent roles, Dr. E serves as chair of the Staten Island Hospital Board of Trustees, PAST, and holds clinical faculty status at Wagner College. Thanks for joining us today, Dr. LaMandre.
It's a pleasure to be here. Thank you for having me.
Can you tell us a bit about yourself and your experience in providing healthcare to the LGBTQ+ community?
Absolutely. Thank you so much for asking me that. And by the way, before I start, I just want to say, for those of you listening, this is for everyone. This is for everyone. Today's podcast is whether you're part of the community, whether you know someone who's part of the community, or whether you don't know anyone at all who's from the community, because if you're a healthcare provider, this will be relevant for you, and I promise to make it relevant for you. So I own EG Healthcare. It is a primary care practice for pediatric and adults. At this point, we serve over 20,000 patients, and we take children, adolescents, adults, and we also have house calls. So a primary care practice like any other, with the exception that we also pride ourselves in being also LGBTQ friendly. And we're going to talk about what that means. And part of the reason I did that is because I'm part of that community. And it is really important for me to make sure that I created a practice that is a safe space for people in my community. And I think that is something that many nurse practitioners do for whatever community they represent. There is a tendency to take care, to make sure that there is a space for our community, especially if our community is not well represented in other practices.
We appreciate you sharing your healthcare background with the LGBTQ community. How can healthcare facilities create an environment that is visibly welcoming to LGBTQ patients?
I love this question so much because so many times we get caught up in just the patient encounter and what do we say, and we will get to that. But the inclusiveness and the welcoming starts way before the patient even sees you as the NP or the provider, right? So it starts with the website. And that does not mean your entire website has to be dedicated to it, but a small flag somewhere, or as in the case in our website, it just at some point somewhere in the website, it says LGBTQ friendly. And for people in this community, they are looking for that. They're looking for these little nuances to let us know that this is a place that is safe for us. You could consider putting it in your bio. I have that in my bio as well. And you also want to make sure that whoever's making the appointments is also well-versed in this. And that just means, for example, being gender neutral on the phone. And what do I mean by that? I mean, we don't necessarily have to say, how can I assist you, sir? Or how can I assist you, ma'am? Because I don't know about you, but there's been many times that I've been on the phone and I said, sir or ma'am, and the other person's like, correct me, or the other. You might assume that a deep voice means masculine and the other way around. So let's just not make that assumption. And this honestly has nothing to do necessarily LGBTQ, but it's just removing the gender from, you could just say, how can I help you? Would you like to make an appointment? Adding the sir or ma'am, which sometimes feels like it's from a place of respect, especially many of us were kind of brought up to say sir or ma'am. It can actually create a bit of a disconnect before the patient even got into the office. So you want to avoid making assumptions. If someone comes in to the office, you also want to avoid making assumptions about husband, wife. You might want to just say partner because you don't know what's going on. And this, again, is not just for LGBT. I can tell you that, especially in my beginning years, there have been times when I definitely tasted my own foot from putting it in my mouth by assuming that someone is a partner when in fact, perhaps they were actually a parent. So this is just something that we recommend in general by just avoiding making assumptions with simple terms. Then it continues on again, where this is all happening before the NP walks into the room. So what's going on in your reception area? So in our reception area in the window, there's just a small little equality sign. It is not noticed by people who it doesn't speak to. It's not huge. It's not obtrusive. It doesn't take up the whole wall. But for the people to whom it's important, their eyes always go there. And they will mention it to me in the room and said, as soon as I walked in, I saw that little sign on the window and I knew I was in the right place. So it is something that, does not offend anyone else. And for many people, they won't even know why it's there, and yet creates so much warmth and a sense of safety for people who need it. And then we have the bathroom, making sure that there is an option for an all-gender restroom. In our case, it's a little easy because we only have one bathroom. And so what we did there, it's kind of obvious that everyone's going to use it, but we took the opportunity to put a sign that says all-gender restroom, because although it's obvious because there's no other choices in our practice, it was just another opportunity for us to show that we're aware and we're trying and that this is the right place for the community. So we have all this happening, and we also have a small little sign that says, I'm just going to read this off, that says, this office appreciates the diversity of human beings and does not discriminate based on race, age, religion, ability, marital status, sexual orientation, sex, or gender identity. It's just a beautiful statement. And we just have it on a nice little frame on the wall. And it's for everyone, right? Not just the LGBTQ community. And it's just a moment. It's like it lets people know that someone who is in charge of decorating or making a decision of what goes on the wall took a moment to just be inclusive. And by the way, that's a sentence from the AMA. And that is where we start. We start before the patient is even in the exam room. Let me take a moment here and just see where that lands.
Thanks for sharing those valuable, nuanced insights. What are key considerations for respectful and inclusive communication when first contacting or being contacted by an LGBTQ patient?
Sure. So as we said earlier, it starts with the phone call and it starts with training. And this is especially important because sometimes we have call centers that may not necessarily be in the office. Sometimes they are in completely different states, sometimes different countries. So making sure that everyone is trained. And then we want to teach people how to use a certain language. And in this language, I really want to take a moment and kind of go into, maybe before we go into language and into forms, I really want to take a moment and maybe go into some definitions. So let's take a moment and talk about definitions, because sometimes it's a little confusing. There's a lot out there and we are getting our information from various sources. And if you've made it this far into the podcast, you clearly want to know, you want some clarification. So let's just go over it. Let's see what that even means. Let's unpack the term LGBTQ. Let's unpack a little bit of the terms that we need to get comfortable with. So let's start with sexual orientation. Sexual orientation means the type of person you're attracted to sexually or romantically. So we have heterosexual, colloquially called straight, which means you're exclusively attracted to people in the opposite sex of what you are or identify as. Homosexual, right, means you're attracted to people who have the same gender. So gay for men, lesbian for women is what you'd usually hear. Bisexual is attracted to members of more than one sex. And right now I'm using the word sex or gender interchangeably. We'll get to that in a moment. Pansexual is attracted to people of all genders and sex. And asexual is a lack of sexual attraction to others. This is an important one because sometimes you'll have someone and you'll say, we'll get into this in a moment, but you'll say, have you had any sexual partners? And when you're taking a sexual history, and some people will say no, or someone says, I don't have a partner or something. You want to be careful from what you might say as positive, like, maybe one day, or, are you looking, because that's an assumption too, because there are a lot of people who absolutely have no desire to enter into a sexual romantic relation. And so in your effort to kind of make conversation, you might accidentally insult someone. So just know that people are asexual and they may have absolutely no interest in pursuing what you might think is, a necessary part of life, whether it's, to be in a relationship. And then we also have questioning. So some people are just, they're not sure. They're not sure if they're straight. They're not sure if they're gay. They're not sure if they're pan. they're just kind of figuring it out. And that entire group falls into questioning, which alludes us to the Q in LGBTQ. So we have L for lesbian, G for gay, B for bisexual, T for transgender, which we'll talk about momentarily, Q for queer or questioning, I is for intersex, A is for asexual, and that's how we get to LGBTQIA. But actually, the alphabet goes on even longer. So we just say LGBTQ plus. And that plus really indicates that while we may not put in the rest of the acronym, we are aware that there is more than this. And that plus is also, just putting that in there is also really quite inclusive. It's really the small things. So let's talk a little bit about sex and gender, because I kind of skipped over that part. So sex is the external anatomy that is assigned at birth, right? So typically it's male or female. So a baby is born, the provider looks down and makes a decision. It's a boy, it's a girl. That is sex. And if the genitalia is ambiguous, the sex that is assigned at birth could be intersex. So this is why we say assigned female at birth. We no longer say a girl, it's a girl, because someone made that assignment. Someone took a look, a human being took a look and made a decision what was assigned. So that is sex, and it's largely based on observation during the time of birth. Gender identity, however, is very different, which is what the person's inner sense of their gender is. So sometimes that correlates with what you were assigned at birth, meaning someone looked down and said, hey, it's a girl. And then you, as a more adult person, feel like you're a girl, so that your gender correlates with your assigned sex at birth. But sometimes it doesn't. Sometimes, although you were assigned a sex at birth, what you feel inside does not match that. And this is hard for some people to grasp, because for them, it's one, right? They've been called a girl, they've been assigned a girl, and they feel like a girl, and they feel female. And so it's very hard for them to disconnect those two concepts. And so be careful of that, right? And that is true for the majority of us, just, statistically speaking. But be careful, because that is an internal bias. So if you're like, that doesn't make sense, how could it be? Either you're a girl or you're a boy. That is your reality. That is what's true for you, because it happens to match for you. So don't mistake your personal feelings that is the only possible reality, because the fact is that it's not the only possible reality. For some people, there is a mismatch, a feeling of a mismatch. So we have the basics. We do have the genders. When it comes to genders, we have a male gender, we have female gender. Cisgender is the majority of us, which means that our gender matches our sex. And transgender means that your gender, what you feel, what you're identifying with, is not aligned with your sex at birth. Now, there are more genders. There's non-binary, which means I don't identify either way. Again, it doesn't really matter what my genitalia is. Internally, I don't identify either male or female. There's gender fluid, which is sometimes I identify differently. And then there are other genders that have been defined. And again, this might not make internal sense for you, and that's okay. We're not here to convince you for it to make sense for you, because it doesn't make sense for you. You just have to know that it exists, and it acknowledges and recognize that even though it doesn't make sense for you, it's still a reality for many. So that's really important. And I want to take that moment before we kind of go into our paperwork, right? So now that we are equipped with this terminology, we can talk a little bit about the paperwork.
Thanks for breaking that down and explaining the definitions for our listeners. These are such important details we may never have taken into consideration, but they make all the difference.
I appreciate that. And anyone who's listening, whether that's the 100th time you've heard it or the first time you've heard it, hopefully you learned something from it. And it's okay to be confused by this. The fact that you're here and listening is already half the battle, probably more than half the battle, because there's some people who won't even listen. They'll go on to the next podcast. So now we're equipped with these definitions, and we are now looking at our paperwork. So in our paperwork, we're going to ask gender identity. And by the way, this has become mandatory in almost all EMRs. So this is not really optional anymore. If you're still in the mindset that maybe, no, I'm not going to do this, it's become mandatory reporting in EMRs. EMRs are catching up, electronic medical records. So we have gender identity is usually something that's in the paperwork. And then we ask preferred name, because if someone is in the process of transitioning, that doesn't happen overnight. It is a long process requiring, time with psychiatrists and psychologists, and there's a long time of paperwork that has to happen. So there will be a time in their lives, sometimes years, where the license or the insurance card says one thing, but they go day by day by a completely different name. And we're familiar with this concept. Like, you might have a name and everyone, you're like, no, but everybody calls me Ted. Yeah, but it says on your paper Theodore. Yeah, but everyone calls me Ted. And we're fine with it when it's a nickname, but somehow there seems to be some resistance to it when, it's a different gender identifying name. So just know that you already have the hardwiring to accept people's preferred names. We just call them nicknames. So you want a space on your forms that says preferred name. Allow people to specify the preferred name. Pronouns, allow them to specify the pronouns. Remember, just because it doesn't make sense to you and you identify as the pronoun that aligns with your genitalia does not mean that's true for everyone. Relationship status. So you want to use inclusive language like partner or spouse. Sexual orientation, give people an opportunity to write that as well. And make sure it's respectful, unbiased language. And of course, somewhere in there, you want to make sure that there's some indication about privacy and HIPAA compliance so that people could feel comfortable filling this out. So the paperwork is really important. Now, are you going to get some people that write nonsense because it's part of their personal agenda to be abrasive? Sure. Who cares? You're not taking away from people who it doesn't speak to. You're not taking away from them. They could choose to leave it blank. They could choose to be silly. But for the people who need it, having that little extra box, the little extra line of ink is so meaningful for them. And that someone took a moment to ask them their preferred name is far outweighs the once in a while person who decides to, do whatever with those questions. And then I just want to say that there's another opportunity in a lot of practices to kind of take a moment. And part of best practices before you open the doors is to do a huddle for your practice and go over what to anticipate for the day, who's coming through the door. This is something we do in our practice. And this is a great opportunity to bring to awareness to everyone, hey, Mr. Smith is coming in. He prefers to be called by this name. By the way, he is transgender, so make sure. So even though he presents she presents female, let's just choose this for a moment. She presents female. We're still going to have to ask her the prostate questions. Like, you want to make sure to prepare your providers and your team to know what screening should be done. So the huddle is a great opportunity to kind of take it all and assimilate it and prepare the team so that it's a smooth experience for your patient.
It seems the language we use along with our patient forms can make a beneficial impact for LGBTQ patients.
You're completely right in that this is very impactful for the patient, which kind of brings us to the question, like, why does it even matter? Like, why are we doing all this? Like, they're going to come in, I'm going to do their annual, I'm going to do their sore throat. Like, why do we have to deal with all this? And the reason we have to deal with this is quite simply because language matters. Language matters. Language can be used to create a safe space or not safe space. And knowing the right words can make a difference between being insulting and really being embracing. And you might say, okay, why is it my job to make it like a safe space? Like, everybody could do what they want. I don't care about their private lives. Why does it have to come in, right? These are the type of things I hear. Like, why does it have to spill over into here? Right? There is a lot of pushback. And the reason is because you became a provider and it is your job to try to eliminate barriers to medical care. And language and inclusivity of language can be a huge barrier to medical care. So let me give you some examples, some real life clinical scenarios that, the lack of creating an inclusive practice had significant clinical outcomes. And if for no other reason, if you don't want to do it for kindness and you don't want to do it because it's the right thing to do it for clinical outcomes, right? So let me give you an example. This is a true story from my practice, a true story of a a gay male teenager who came to our office. He was 21 years old, and he was so excited that he finally aged out of his pediatric care because the pediatrician was chosen by family in a very particular culture, and he was never able to disclose that he was gay. So the practice he came from had no world of inclusivity. In fact, it was very connected to his culture, and there was just no space to have this conversation. So I literally remember this day, like he was just so happy finally to for his parents not to know, but also to come to a practice that he knew was LGBTQ friendly. And it was the first time, and he's been sexually active for years, is the first time he was able to ask for an STD test. So we did that. And he's like, I really want to go on PrEP, doing all the things that we would want someone who is a non-monogamous relationship to do. Great, let's do the STD test. As soon as these come back, we'll meet and we'll start you on PrEP to help you prevent HIV. So this is his first STD test, and I had to be the one to tell him that he was already HIV positive. He did not have access to the most basic of care, which is just testing, because he was in a practice that was not inclusive. This is a real story. And so I had to be the one to break this to him. 21-year-old finally feels like he can live his life, and his entire life changed. He's doing well, and he, thank goodness, right, has all the things in place. But this is why it's important. It's important because your personal bias, in this case, this pediatrician's personal bias, really impacted this child's life negatively. And there are already so many barriers for the LGBT community to have, right? There's legal and regulatory barriers. There are some states that make it okay to say that you don't want to give care. There's also the barrier of providers have limited knowledge and limited training. We don't need to add the difficulty of something as basic as just language and an intake form.
Next, how can healthcare providers ensure continuity of care that respects the patient's gender identity and sexual orientation?
So that is a really great question, because we worry so much about our moment with the patient, but what happens once they leave the door, right? What happens when they go to the next provider that you refer to? And so we really have to be careful here. If possible, the ideal situation is that every single person you refer to also has an LGBTQ friendly practice, but that's not always feasible. Okay, so then you kind of have to, if you have to, pick and choose and make sure that, especially in sensitive areas, that you did some due diligence before sending the patient along, because this could be really traumatic. For example, if you have a patient who is male presenting, right, passes as male, but still has female genitalia, that patient is going to need a GYN exam. And if you're just going to send them to a GYN who is really clueless about transgender health, it could be a really traumatic experience. So perhaps you can get away with a dermatologist who doesn't have the most LGBTQ friendly practice, but you would really be remiss if you sent someone that, like I just described, to a GYN who is not comfortable in this community. Quite honestly, it would be traumatic for both the provider and the patient if the provider is not ready. So if you don't have a list, make a phone call. Say, hey, I'm sending this patient over to you. I want to give you a little bit of a background, just as you would the medical history. For the sake of the patient's experience, it's really important that you take the time to create a safe continuity of care. In our practice, we really have chosen other practices that we know will provide that same care. And also, we've established enough of a reputation locally that people know that the patients from our practice might need, well, everyone needs inclusive care, but their antennas are up from their referral source from our practice. But if you're not in that position and you're not the person in charge of making that referral list, it's still up to you, especially if there's something sensitive going on, to pick up the phone and help the continuity of care. It's a critical piece, because otherwise your care has not been fully developed.
We hope our listeners keep these ideas in mind for their practices. Dr. E, do you have any final thoughts or key takeaways for our listeners, especially those who are nurse practitioners or healthcare professionals working in the LGBTQ community?
Absolutely. First of all, kudos to you, whoever you are listening or watching, that you made it to the end of the podcast. So that's my first final thought. Thanks for being here. But, outside of the joke, the fact that you've watched this whole way means that you care. It means that you care enough to spend this, however many minutes this podcast is, to listen. And that is what's important. What's important is that you are taking the time to be what's called an ally, right? An ally is someone who stands up for, supports, and encourages the people around them. So it is really kudos to you for wanting to be that ally. And that's all we could ask for in life. It is okay to mess up. It is okay to make mistakes, especially if the intention is not for malice. Tell your patients, I'm really trying. This is new to me. Feel free to correct me if I do it wrong. The patient is going to be so happy that you're trying and being vulnerable in that space. So thanks for being here.
Thanks again for your time today, Dr. E.
It was a pleasure.
For more great content from the Nurse Practitioner, be sure to visit us online at tnpj.com for the latest NCPD articles, columns, and much more. Please leave us a 5-star review on iTunes and Spotify, as it helps with the podcast's visibility and helps us to keep bringing you this great content. Also, don't forget to follow us on Facebook, Instagram, and LinkedIn at the Nurse Practitioner Journal, and on Twitter at TNPJ_journal. Thanks for listening. This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed on this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer. Please note that the hosts of the Nurse Practitioner Podcast are not clinicians. However, we created the Nurse Practitioner Podcast to bring you relevant clinical information by NPs for NPs. Thanks again for listening.